Hi, this is Christy Oski here from the Clinical Strategies Division, and I'm here to bring you this week's The Right Way Wednesday. We're going to focus a little bit on health literacy and teach back in your evaluation, and I'm going to take a little bit of what Tony Barger had talked about last week regarding patient and caregiver education, and just expand on that a little bit as it relates to health literacy. So let's start off with what is health literacy and what is teach back. So health literacy is actually the ability of the patient to understand and process health-related information in order to make informed decisions about their care, what to do if a problem arises, and how to handle mitigating factors of potential exacerbation and rehospitalization. And then teach back is actually the method, simply put, if I teach you something as your therapist, I need you to teach it back to me as if I'm your patient. This will help dispel any potential misunderstandings related to that education, and then you can really understand if the patient truly understands the education that you're providing. So it's a really helpful method. And then moving forward, if the patient is unable to teach back the information taught to them related to health literacy, you can adjust your plan of care according to that. And documentation on adjusting your plan of care is a skilled intervention and is required, and it will help those who are either carrying over the treatment or those reviewing whether the treatment was skilled or not know that you provided teach back and you adjusted the plan and the treatment based on the ability of the patient to teach back the information. So we're going to start talking about the evaluation and how it relates to health literacy and teach back. For those of you using Safe Transitions and the Discharge Readiness Checklist, this is generally where I start, and you know that health literacy and teach back are a huge part of that Discharge Readiness Checklist. I think any good evaluation starts with a stellar therapy necessity, simply stating that you and your discipline, what does this patient need from you in order to transition to the next level of care? So this is like your major statement of the needs based on that Discharge Readiness Checklist, which we know that health literacy and teach back are a part of. So simply stating that the patient will require health literacy regarding the COPD diagnosis or CHF diagnosis or diabetes, including teach back. The evaluation is also key when looking at the cognitive status of the patient. So if you don't do a cognitive assessment on your eval, OTs, and speech, you need to. We recommend the SLUMs, not that you have to do that for everybody. You want to interpret the results of that test and then pass that on to the physical therapist as well. And what that does is it identifies who the health literacy and teach back is meant for. Is it the patient or the caregiver? If the patient is unable to understand and to carry over any information that you've provided them, it doesn't really make a good point to focus all of your efforts on the patient. You have to then move to the caregiver. So that's point number two, really important of this eval. And then your short-term goals. You're going to need to write task goals within the Health Max system. So these are kind of not pre-populated goals, these are goals on your own. So I'm going to give you a couple of recommendations for appropriate health literacy and teach back goals. So if your plan of care is focused on the patient, here's an example of a great task goal that you can write related to health literacy and teach back. The patient will be able to teach back the signs and symptoms of COPD exacerbation either independently or with 100% accuracy. That's really a patient-driven goal. If you're focused more on the caregiver, then you may have a similar goal that the patient may be able to teach back the exacerbating signs and symptoms of COPD when properly supported or guided by the caregiver. And you may probably do that at the supervision level if the patient is able to verbalize those symptoms or teach back those signs and symptoms of exacerbation, but they need the caregiver support. We educate the caregiver and the caregiver supports them to be able to recall and teach back those signs and symptoms. It's more of a compensatory strategy for that piece. So those are just two quick examples of some health literacy goals. Those will be helpful in the short-term aspect for those, whether it's an assistant or another evaluating clinician who's going to carry over that plan of care, to know that health literacy is a huge piece of that. I'll do another segment talking more about daily notes and billing at a later date, but I think it's important to kind of get your plan of care started and focus really on that health literacy using the teach back method. And I think that's all for today, so thank you for watching this week's The Right Way Wednesday.